Hello, Dr. Lindsey Hanna here, physical therapist, and today I want to talk about the external rotators of the shoulder, why they are important, why they're often neglected, and how they may be contributing to your neck pain. So your external rotators sit on the backs of the shoulders here. Their job is obviously to externally rotate, which is basically this motion here. However, they also play a very vital role in the stabilization of your shoulder or keeping your shoulder where it needs to be when you're moving through the world. Our shoulders are an amazing joint. They have so much motion. Your shoulder, you can really move your shoulder a ton. Because of this, it's often unstable because it has a lot of muscles and their job is to keep it in place and keep it exactly where it needs to be, so that it can go through all of these motions. And we use a lot of the big muscles in the shoulders when we're at the gym. We often don't focus on these external rotators and they often get weak. And so a lot of the bigger muscles just kind of take over. And that can cause neck pain, especially if you are using your arms a lot or you're doing a lot of weightlifting and you're noticing that you're just always tight and having pain through here, and you're neglecting your external rotators. So if you are having neck pain and you've changed up your, the way you sit at your computer and you're doing neck stretches and it just keeps coming back, one thing you really, really must look at is the shoulders. So we're gonna start with the external rotators. I'm gonna show you a couple of simple exercises that you can do at home. You can use light weights with these, but sometimes you don't even need light weights. So come on down to the floor with me for this one. So for this first one, you're gonna lie on your side, and it helps. You need something under your head so that your neck is neutral, because you obviously were trying to protect your neck and you want to keep it. So don't just rough it out and just say you're gonna do this because you're gonna create problems and you're trying to fix those problems. So you're here. So you're gonna keep your elbow at your side. You want to pull your shoulder blade back and stabilize it. Then you're just simply gonna lift your arm up like this. So a couple things you want to avoid here. Again, as you lay here, most likely, your shoulder's gonna wanna just be here. So and if you try to do it from here, you'll notice you can't go very far. So you gotta get your shoulder back and pull that shoulder blade down, and then you're ready. So then you're gonna lift. From here, make sure your elbow stays right next to your side. Don't let it leave your body. You don't wanna rotate your body back. If you have decent rotation and you're aligned right, you should kind of be like your arm is pointing up towards the ceiling. If you're not, that's okay. It's unlikely that you can go a whole lot farther than that without twisting your body or kind of compensating. So keep it here, up and down. So again, everything you do, you want to pull your shoulder blade back, slow and controlled motion. You can start with nothing. You can grab a soup can. They usually weigh about half a pound. Grab a soup can, grab a water bottle, or grab a light weight. So this is a 3. So shoulder blades back and we're rotating up. When you get to the top, pause there at least 2 seconds. And this will always prevent you from just getting into a swing kind of motion, because that's tempting, but much less effective. So you're holding and you're rotating. So you should feel this burn in the back of your shoulder, near your shoulder blade, possibly down the back of your arm a little. You might feel it a tiny bit up here, but you should never feel that as the primary muscle. And if you are, you got to check your form and realign. So I recommend doing a set of 10 or 15 until you feel a burn, and then do that 2 or 3 sets. Do both sides. You really need just a light weight with that. Even if you're someone who's lifting pretty heavy and you're pretty strong, I really recommend starting light and just getting that good burn and working on your form before you go heavy, because these are smaller muscles. These are not as big as your rhomboids and your middle traps and your deltoids. These are smaller muscles, and so you don't really need as much weight. And you really want them a lot for endurance, which is why I would go for sets of 15 or 20 with a light weight and get a burn. The next one, we're gonna shift over. So for this one, you want to be supported. You want your arm supported on a surface. Okay. I am my own cameraman here, so bear with me. Okay, so you're here and you're here. So you can use a pillow or whatever you need to get your arm so that it is rested on a surface. All right, and then from here, you're gonna rotate your arm up like this. So again, lightweight or no weight. You want to keep it slow up at the top, and you should, again, if you have decent motion, you should be about like this, where your hand is pointing straight up. If you're going a whole lot further, check your form, because this is not what you want. You want to stay in alignment and you want to have control. You definitely have to have control over whatever you're lifting. And again, you want to watch your shoulder. What you don't want is like, you know, your shoulder, like your neck and your shoulder coming up. So you really have to focus on that shoulder blade and pulling it down as you do this. Again, same principle, light weights, slow motion, all of that. Really, really focusing on that shoulder blade. You can also, if you want to take that one step further, you can practice that without having your arm on a surface. So you can just practice this motion. Again, really focusing on your form. Grab a weight and you can focus on it here. Like this. You can also do this like the cable machines at the gym, but again, form is like so essential here that you make sure that you are feeling it not up here and that you're keeping that shoulder blade pulled down and you're feeling it in the right places. So this is some place to start, just addressing these external rotator muscles. Again, these are often neglected. They're just not something that we do at the gym. It's not something that's really focused upon, but they're super functional, and having strong external rotators will stabilize your shoulder and allow you to do all of the other really bigger and more complex motions that you need to do with your shoulder, especially overhead work. If you're someone who does a lot of overhead work, it's really important. And as always, if you have persistent pain, if you're having more problems, if you're having radiating pain, if you're lacking movement, if you're like, I can't even get my arm in this position and I don't know why and nothing feels right, I definitely recommend that you seek the advice and hands-on treatment of a physical therapist. I'm a mobile therapist. Again, I am the founder and CEO of Hanna Physical Therapy. So I'm mobile, so I travel to people's homes and I will see you there. Sometimes you do need some hands-on motion to get your shoulder unstuck, especially if you're having a lot of pain or things just aren't moving right, and then you need to get your shoulder moving. So if you have any questions about this, please shoot me a comment, follow for more advice, and I thank you for your time and watching.